The abdominoplasty is a tremendous operation for women that have had multiple children. Typically, you have some widening of your rectus abdominis muscles called diastasis recti that needs to be repaired surgically. So in an abdominoplasty surgery, typically we're making an incision from hip to hip, and then we're lifting up all that skin, removing the extra skin, and tightening that abdominal wall. That kind of helps recreate your silhouette that you had probably before you were having kids, or if you have gained weight and then lost weight. I typically couple the tummy tuck or abdominoplasty with liposuction procedures just because removing extra skin is great, but usually you have a little bit of extra stubborn fat, either it's on your back or your hips, or even that abdominal flap can be a little bit thick. So giving you some definition and kind of highlighting those curves are much easier to do with liposuction. So, and after that surgery, you're staying one night in the hospital, typically going home the next day. You'll have a compression garment that I'm typically having you wear for 6 to 12 weeks. We're emphasizing how important it is for you to be walking around the house and up on your feet and back to normal activities. In ways that I can make sure you're comfortable doing that, I'll inject something called Exparel. It's a long-acting local anesthetic that will basically numb your abdominal wall as well as some of the skin on your abdomen. So you should be very comfortable after that operation, which will help you mobilize a little bit more quickly. You'll probably need 1 to 2 weeks off of work, and then you're going to avoid any heavy lifting for at least 6 weeks after that operation. There's a considerable amount of downtime with the tummy tuck operation, but I think it's also really worth it if you feel like you're looking to have that body contour back that you once had. I want to help you achieve those goals.